I mean, obviously, that's one of the big hot topics in MS, and also in some other conditions. There's some potential investigation for vitamin D and sun exposure to modulate infection risk or general mortality risk, cardiovascular disease and such like. But in terms of the MS space, there's been a lot of work, including some work by my own group, looking at the relationship of sun exposure across the life course and vitamin D levels, both prior to disease onset and then during the disease course. We've shown some evidence that these may be associated with less relapse risk, either during the established disease or even early in the disease course. And also potentially, the Ausimmune case control study, which has done a lot of work in this respect, suggesting that sun and vitamin D are independent risk factors. So low sun exposure and vitamin D deficiency may be independent risk factors for MS risk. However, while there's been this wealth of observational work, as I've just described, and also the aforementioned latitudinal gradient, which is a strong indirect evidence in support of a role for sun and vitamin D, because again, the most plausible factor underlying the latitudinal gradient that we see so consistently across the world is sun and vitamin D levels. However, despite the consistency across all of that evidence, when they've gone and tried to do vitamin D supplementation, either alone or alongside drugs like interferon beta, in RCTs, they found little or no effect. So this is an area of significant discussion within the community, the scientific community in MS. The recommendation that we're generally making to patients, and we put this out in the MS Australia, published some guidelines for people with MS and also for medical practitioners with regard to lifestyle factors. And the conclusion in that chapter about vitamin D and sun exposures, effectively, there is not enough evidence to suggest that anybody with MS should go out supplementing or trying to increase their sun exposure any more than would be recommended for their general health and as recommended by their GP, which is to say, maintain vitamin D sufficiency for your general health, and particularly for, when you're older, for things like bone health and calcium homeostasis and such like. But there's not enough evidence, unfortunately, to suggest that taking these supplements could be beneficial to their disease course in MS.